Welcome to the Voices for Voices TV show and podcast. I'm your host, Justin Allen Hayes, founder and executive director of Voices for Voices. At the outset here, we would ask that you please subscribe, share, like, comment on this episode and any of the other episodes that we have on our video platforms, YouTube. We're now on Vimeo with episodes here in 2024. As well as all the audio platforms you can think of that you consume your content that way. So if you can help us out, we'll be able to help more people, and that's the goal of our organization. And I think just as a human being, a human race, that's something that I think we can all agree that is a good thing, and we could do more of. So Voices for Voices, the TV show and podcast, is the #1 ranked TV show and podcast where people turn to for expert mental health, recovery, and career advancement intelligence. So our TV show and podcast is all about teaching you insanely actionable techniques to help you prosper, grow your self-worth, and your personal brand. So if you are a high achiever or someone who wants more out of life, whether mentally, physically, or spiritually, please make sure you subscribe to our TV show and podcast right now on whichever platform you are consuming this on. As you can see, our TV show and podcast publishes episodes that focus on case studies, real-life examples, actionable tips, and in-the-trenches reports and interviews from subscribers just like you. So if that sounds like something that you think could help grow yourself personally or professionally, or someone you know, then please join me by subscribing, liking, sharing, commenting. This episode and all the other episodes we have were well over 100 at this point. A quick programming note, in 2024, every other Friday, we have a bi-weekly roundup on Facebook Live, where we discuss current events that we may not get to in time here with the kind of our big show here, because we're filming a little bit in advance. So we cover local issues affecting the community. We look at maybe some of those issues that are also affecting us as a nation. And then some are, as we know, are global issues, and so we try to have that more casual of a conversation. So keep your eyes peeled for that. And again, we're on Facebook, Instagram, X, TikTok, LinkedIn. We have the business page, so we're everywhere. And then, like I said, YouTube, Vimeo. We have our own channel, as well as all audio platforms. Keep your eye out for our announcement coming up about our A Brand New Day Gala coming up this October. We'll have our 4th annual event, and we can't do this without you and your support. We are, as an organization, a 501c3 nonprofit charity, so we accept donations. Every cent, every penny helps. We know you have many organizations, many different causes that you can share and donate to. So we would be honored if you would make our organization part of your giving plan for 2024. And we also offer sponsorships for the organization on an annual basis, as well as you're able to sponsor a podcast and TV show episode if you'd like. Our October Gala. There's many different opportunities. If you know somebody or yourself have an organization and think that you may benefit, we'd love to have a conversation about that. You can reach out and contact us on our voicesforvoices.org website, or you could email us directly at president@voicesforvoices.org. So we're on episode 2 for our guest now in studio from the Summit County Public Health Department. We interviewed both of these guests last year, had great feedback on the content that was provided, the awareness that is provided in the programs that are being instituted, and then the growth of that. So we thought we'd bring them back for 2024 for a new episode, which now new episodes, plural, since we're covering so much great information. So in studio from the Summit County Public Health Department, we have David McCartney and Megan Scott. Thank you for coming back.
Yes,
thanks for having us.
Yeah, so for those viewers and listeners and that tuned in for our first of this two-part series, we were closing out that episode talking about polysubstances and how, which means just for the common person, more than one substance put together, whether knowingly or unknowingly. So maybe we could pick up the conversation there.
Yeah, absolutely. So so just to give a little context, a polysubstance death is, like you said, or a polysubstance overdose is one where someone has more than one substance in their system. So it could be a combination of really any of the substances that we look for. So most people think like fentanyl, cocaine, methamphetamines, but we also look for alcohol and marijuana, so that we can really get an idea for what that person had in their body that caused their death. One of the things that we have that David and I work on at Summit County Public Health is actually a overdose fatality review board. So we look at those fatalities and we take data from them kind of in aggregate and look at what's happening in the community, and try to see what's going on, what interventions can we help, what recommendations can we make based off this information. And polysubstance deaths is something that we've seen a big rise in.
Sure. And further that, we also do individual case studies on that. So we do have an aggregate report that comes out at the end of the year in April, but in collaboration with the ADM, the justice system, court systems. Who else do we have on that board?
We have several different partners that we get information on, criminal justice, law enforcement, some treatment and recovery when it's available, and the medical examiner.
Yes, and so all that data is then compiled on individual case studies that we pull, and so it is a multi-collaborative effort to try to understand the bigger picture. But again, that data only tells us what the data tells us, and so we recently have started to expand on the Overdose Fatality Review Board to do next of kin interviews, where we can then reach out to the family or the friends or whoever is next of kin for that individual and try to pull together a lot more of that story and who that person was as a person, and not just as a data point. So like Megan had said, we have seen an increase in the number of polysubstance use deaths overall, but also in our review board we see that oftentimes as well. I mean, 60% of all the overdose deaths last year did have polysubstance use. And so when we look at that, normally you think of overdosing, you would think of a lot all at once, but that's not the case with all these substances. If we see somebody who has a prior medical history of cocaine substance use, but then in their toxicology report there is cocaine, but also a small amount of fentanyl, they're not expecting to have that fentanyl in there. There's no tolerance. So understanding how the body reacts to different substances is important as well. And so, it's not always, like Megan had said at the end of the last episode, it's not always what they're getting is what they're expecting to get. And so, again, that's why we have the fentanyl test strips. That's why we promote that for any substance and not just for what you would normally typically expect to use. And so that has been fun, but interesting to see how that trend has increased over the past couple years, what substances are being more affected, and what type of individuals are using those substances. So we're seeing all sorts of shifts demographically with different substances, with areas, and so it's just, it's hard to pinpoint the exact, there's no magic wand to wave it all the way and to fix it. You have to look at it as a individual case-by-case basis while also trying to reach the general population as a whole.
Yeah, I I would think that that's a challenge
yeah.
for a lot of areas, but
Yes.
specifically trying to pinpoint exactly, and then you have the zip codes, and there's a lot of things you're trying to cross-reference and say, oh, well, if it's this and this and this, then we can troubleshoot, and this will take care of a high percent. But that's not always the case.
Yeah, whenever you're working with people, there's always going to be unique factors. So we can look at the data and we can see, like, if we talk about the data that David shared last time, just looking at it, you might think that white males were the only people who were really experiencing a problem, because overwhelmingly that is the proportion. But when you look at it in the context of our actual population and the spread of different races and ethnicities and age groups and genders and sex, then even though one population might look like they have a lower number of overdoses, in the context of the population as a whole, there's a large rate of overdoses. So that's why we look at things like targeting interventions to reach the Black community, because even though when you look number to number, they might have less overdoses overall, it's affecting their population at a larger rate than it might affect another population.
Right.
So we have to look at all of that. And then with the case studies, we're able to really drill down and talk to people instead of just about the numbers.
Yeah.
Tell me what your loved one was like. Tell me who they were. Tell me what you think could have helped them, and then incorporate that into the data that we have to see both sides of the picture.
Yeah, and so maybe you can share, obviously not specific conversations, but just at the aggregate, do maybe in general family members, they, I'm saying, feel good about sharing the story about their loved one, that somebody cares and somebody's at least asking, that it's not just a number.
Yeah, it does that, but it also, I think it allows the family member to really get the real story out. So, for example, we might look at someone's criminal history and get a certain image of what the stereotype of that person is. But then we find out maybe while that person was incarcerated, they got a college degree and learned new job skills and came out of that incarceration a completely different person. That is two different stories. If all you have is the data to show that there were poor choices in their life and not see what they did with it afterwards, it completely changes the narrative. So the family members are able to give us that information so that we can really look at that person as a whole. And it also allows them the opportunity to get their story out and kind of remember their loved one in a way that's pretty unique.
Yeah.
But also on that note, it also allows us to have a little bit more of a gap filling in too. So not necessarily like the context of the story in the person's life, absolutely, but also where were the interventions that we could have expanded upon?
Yeah.
Where could we have done better? What was missing from different subsections of their life that we could have, that need something, need that extra little boost, need to be examined, need to have conversations with community partners as to like what can be done. And so like that's also a very important aspect of these conversations with the family, because the data tells us one thing, but that's not the full picture.
So for example, maybe the person was offered treatment and treatment was available to them, but they would have had to quit their job, which means they would have lost their income and the insurance that would have paid for the treatment. So what we see when we look at the data is they never went to treatment. But the story is that there was a hurdle that they weren't able to come over. So how can we work with our organizations in the community to help make sure that next time that happens, that barrier isn't there for the next person?
Yeah, I mean, I can think of one area that our organization is looking at is the transportation issue.
Yeah, that's a big one.
Potentially being a part of that, with they had employment opportunities or they had chance to get help, but they, other than $3,000 or $5,000 ambulance ride to the hospital,
absolutely,
and like, okay, do we have insurance? Don't we have insurance? How are we going to pay for this? Getting people not to feel so alone specifically on the job front, or doctor visits or therapy visits, and like, okay, like, yeah, I can do the Zoom and the online. Maybe they don't have a phone, maybe they don't have access to internet unless they have a ride.
Right.
And
so that's what with the Overdose Fatality Review Board, we get a decent amount of data, and then the very new edition of the next of kin interviews and really talking to people who knew that person allows us to kind of see where those things lie.
So I talked to David and got his feedback about how the work he's doing makes him feel, and how his kind of career path was, and to where he's at now, and at his core, helping people is where he sees himself as the putting a lot of energy in a positive sense, and hopefully taking some of the stress, and so being able to identify, okay, I like doing this, but this specific could cause me extra stress. So how can I still be a part of this bigger picture and not have potentially the added stress?
Yeah.
For you, Megan, how are you tied into your role, and how did you get to where you're at? And if somebody is watching or listening, has an interest of how they can learn more about the type of work that you do.
I actually came in, and I think I talked about this when I was here last year. I came into public health as a licensed peer supporter, which means that I was someone who was in recovery that was able to use not only my life experience, but a specific set of guidelines and trainings and education that's provided by the state to get licensed to help other people in their multiple different paths of recovery. So I was able to use that experience to come in just kind of in a very isolated role to work in some of the opioid programmings. And once I got here, at the same time, I was working on my master's in counseling. So I'm also a mental health provider, and I have my substance use counseling degree. So it's very client level, very focused on working with people individually. As I came into public health, I realized that the things that are available for my clients are only available because there are organizations that have this data and are able to realize what gaps we have in the community and tie that to the best practices that organizations like the CDC and SAMHSA are able to do, and really use evidence to provide the best possible situation for each person back down on that individual level. So I still work on an individual level outside of public health, but it has really shown me how everything that we do is connected, and how all the different systems that we have are connected, and that admittedly there's problems with some of them, and there's some that don't communicate as well as they should. So being able to be a part of the organization that takes the data and combines it with best practices to help people has been incredible.
That's fantastic. From a what type of education or certifications did you have to go through? So somebody's like, yeah, this sounds like something that's interesting to me. What do I have to do?
Well, I will always promote peer support. So anyone who has lived experience with mental health disorder or mental health issue or substance use disorder or both can get licensed through OMAS, at the State of Ohio Mental Health and Addiction Services Board.
Okay.
And that peer certification, like I said, it just gives some additional training on things like ethics and multiple pathways to recovery, because abstinence is not everyone's story. Different ways that you can work with people using certain types of techniques like motivational interviewing, and being able to guide people on their path in a professional way, but also combining lived experience. So peer support certification is incredible. For the job that I work, technically none of my certification was required, but I do maintain a CDCA, which is a chemical dependency counseling assistant license. And I'm also currently working towards my LPC, which is a licensed professional counselor. So that kind of mental health training and education and knowledge and practice, because I do have clients that I see, allows me to kind of take all those varied experiences and apply them in a way that's very different than the way David does. As we saw, he's very numbers and data oriented, and I can combine that with kind of the behavioral health perspective and see where we can meet in the middle to make recommendations to people.
And I feel like that's why we work so great together as well. We have different approaches to how we come to it, but we still come to the same conclusion. We still want the same things. We still are advocating and pushing for exactly the same thing from just different perspectives. And so, it's kind of interesting. We'll be we'll be communicating and we'll say the same exact thing at the same time. So, we are a great team. We're
Yeah.
pretty much the same person, just the right side and the left side of the brain separately.
Yeah, it's worked really well.
And I think, yeah, there's that common thread of wanting to help others at the core, and there's different ways you can do that. So if you want more of the applied and the project based versus numbers, that there's still a way that we're helping people. We still have that overarching goal that whatever we're working on is going to impact. And I mean, the fact that you're able to share not only the data, but a little bit of the story, I think is helpful as well. I know for myself, traditionally, earlier in my career, having the numbers was like the best thing. But then as things evolved, it was, okay, how do we take the numbers and have actionable insight and transfer that? And to see you being able to do that, David, is awesome. That you're taking not just the numbers, but making some inferences and recommendations, and that you're working so closely that you're able to bounce ideas off and still have that overarching goal.
Yeah, absolutely.
Okay, so we have a couple more minutes left. How can viewers, listeners learn more about the Summit County Public Health organization itself, the different programs, how they can, I don't know, if there's volunteer opportunities, or when the programs are going to be occurring, if there's a calendar, just kind of the how-to of how to find that information?
Yeah, that's a great question. Our harm reduction program, Summit Safe, meets on Mondays, Wednesdays, and Fridays. So Monday and Wednesday, it is at the Arlington WIC location, which you can find the address for on our website. And then on Fridays, it's at our main location, our main Summit County Public Health location. And that's where people can get Narcan and harm reduction supplies, meet with a peer supporter, and get referred to services like housing or food services if they need them. That's the major client-facing program that we have in our harm reduction department. But on our website, SCPH, Summit County Public Health, scph.org, we list all of our different programs and information about Project Dawn, but also our WIC programs and our dental clinics and everything else that we have there to help the community. Great.
Yeah, and I think that's one thing that I've noticed is that the public health department, there's not just one thing that happens once a year, that there's ongoing programs that are happening. So to hear that, I think it can be helpful to individuals like, I can't wait till March, or I might not be here. Like have that attitude of being in the depths of despair and going, oh my gosh. And instead of that, it's like, okay, well, what day is it? Oh, it's Wednesday. And so I get a ride or to be able to.
And naloxone, I will also say, is available for free online. It can be mailed directly to someone's home. On our website, you just fill out a little form so that we have your address, and we can send it to anyone. And so we find we have a lot of people who maybe aren't ready to talk to someone person to person, or family members who know that they have a loved one who is actively using a substance or on pain management. They can get it for free without speaking to anybody on the website.
And also on that note, Megan, the vending machines. You can also access naloxone through that. Technically, we would want you to register so we can just have some demographics, but you can still access naloxone without registration at both of the machines, one outside of CHC in East Akron, and then one in the Barberton Municipal Building. And so if you just type in 4 zeros?
Yes,
four zeros.
The machines.
You'll be able to access naloxone and get it for free there as well.
And both machines have the instructions written out. It's very simple, and it's available 24/7. So.
And I think that's, it's very, very helpful, and I think I'm noticing a little bit of a growth in last year. There might not have been those vending machines, and so that growth of, okay, this is an issue. We need to continue investing dollars and grants and donations to these areas, and to see that kind of growth of, okay, we have this product that can help, but you can't get it everywhere, and now it's a little bit more widespread, and now it's in vending machines, and I think that also it can be helpful. Of, I don't want to log on the website. I don't want to talk to somebody,
Same.
but I can go to
Right, yeah.
right. I'm kind of in the same boat. I was like, but I can go to a vending machine and gather that is I think a great thing to take. Just the last, I guess, kind of thought that it was coming to mind. I was in Las Vegas for a conference a couple years ago, and I was right in front of the Bellagio, just walking down the street, and there was a person that had just overdosed, and so she was laying on the pavement on the sidewalk, and there was a group of people, and saying help, help, and then you hear the sirens, and people don't think whatever about Vegas, but my reason for bringing that up is to show that this isn't just a Summit County problem. This isn't something that was born in Summit County. That this is a wider problem, and that's how things kind of got to the local level. As it started as maybe like the big cities potentially, and then it started to seep in to really everywhere, and so that's really, we're taking maybe like a reactive situation, and now we're turned into more of a proactive of okay, we got the data, we're going to continue to report that, and we're going to continue to look at the best ways we can intervene if possible. If somebody wants to that intervention, that's another story, but are there other touch points where we can reach out to others that may be experiencing the same things, and then to have the ongoing projects and the syringe exchange program and all the harm reduction, to know those are even available is great for community members.
And it's a great place for people to come to just feel safe in their own dignity, in their own respect. Our staff is incredible. Like I said, it's a peer supporter mostly that manages that, and so we found that just allowing people a few minutes with someone who can talk to them like they're a person and they don't have that stigma placed upon them keeps bringing people back. And the more that we see them, the happier we see that they start to become with themselves, and hopefully make some behavioral changes to keep themselves safe.
Keep them safe, and Great. Is there anything we haven't covered? Any information, websites, socials you want to share to make sure that we...
I think that's really it. We do have, Summit County Public Health does have Facebook and I think a LinkedIn account. And so we share a lot of our programming across the department completely, not just harm reduction. Anytime we have awareness campaigns and things like that, they can be seen there as well.
Right. David?
Just from the data aspect, we do have dashboards online as well.
See?
And
Numbers one.
You can also request data. I can't guarantee that we'll be able to provide it all the time, depending on what you want. But sorry to our epi department, but we do have a form you can request data through as well. And so that's one other aspect of the situation. So
a big part of what we do is making sure the community is aware. So anytime someone has a question like that, we do our best to provide factual, evidence-based information. So.
Right. Well, Megan Scott, David McCartney, thank you for joining us. Thank you for coming back for a second episode. Thank you for the work that you're doing, and we look forward to having future episodes in 2025, if not maybe sooner.
All right. Thank you for having us.
Absolutely. Yeah. And thanks to you, our viewers, our listeners, checking out maybe our transcript across any platform, YouTube, Vimeo, all audio platforms. You can find us. Share this episode and other episodes of the Voices for Voices TV show and podcast. I am your host, Justin Allen Hayes, founder and executive director at Voices for Voices. And until next time, be a voice for you or somebody in need.